This series is called Moving Away from Family Separation, Cross-System Strategies to Support Young Children and Families at Risk of Child Welfare Involvement. This particular webinar is number 5 in the series, and it's called How to Build a Bridge, Policy, Practice, and Relationships in Cross-Systems Collaboration. I am Cynthia Tate. I'm with the BUILD Initiative, and I am your moderator. At this point, I'm going to introduce you to Sam Guzman, who is our language interpreter, our translator for today, and he's going to give you some instructions. Sam?
Yes, hello, thank you. Hello, everyone. My name is Sam Guzman, and I'm here with the CLC, and the organizers of this event have made a commitment to language justice. What that means is we want to create a space where everyone can participate and engage in the language that they feel more comfortable in. We will use the simultaneous interpretation feature in Zoom to create this space. I'm going to repeat the same statement in Spanish, but when that's done, we're going to activate interpretation, and you will see a globe icon at the bottom of your screen, just like it is on the slide. Click that button, click that icon, and from there, select your preferred language, in this case, either English or Spanish. Many people think that if they speak English, they don't need to activate interpretation, but in fact, if someone participate and engage in Spanish, you'll be able to hear in English simultaneously. So please, everyone, regardless of your preference in language, go in there and select your preferred language. Unless you're completely bilingual, then you can choose not to activate it. Let me repeat it in Spanish so everyone can have the same information. Buenas tardes a todos. Mi nombre es Samuel Guzmán con la CLC. Y los organizadores de este evento se han comprometido a la justicia del lenguaje. Lo que eso significa es que queremos crear un espacio donde todos pueden participar e involucrarse en el idioma de su corazón. Utilizaremos la función de interpretación simultánea de Zoom para crear este espacio. Cuando termine de decir esto, activaremos la interpretación y verá un icono de globo terráqueo en su pantalla que dice interpretación, tal como está en la diapositiva. Y de allí oprima ese botón y seleccione su idioma preferido. One more reminder, if you are presenting today, a quick reminder is that Spanish is 20% longer than English, so just speak at a measured conversational pace so we can make sure everything is captured and interpreted as well. All right, if we can activate interpretation and everyone select from there their preferred language, and we can get started.
All right. Thank you very much. And thanks everybody for selecting your language. And thank you, Sam. Okay, so the objectives of our webinar series are these: to raise awareness about young children and their families involved or at risk for involvement with the child welfare system, to educate our participants about the racial disparities in family separation and child welfare involvement, providing examples of cross-systems collaboration on behalf of our youngest children, which is the primary objective for today, and promoting opportunities and upstream strategies for prevention. Okay, and for today, our objectives are to learn what Illinois found out from 2 communities that they worked with around barriers and challenges. We're going to understand how Washington State's Child Welfare Early Learning Navigator program uses a team approach to help families navigate both systems. And we're going to hear how Kansas created institutional linkages with the input of those who have lived experience in their KanLink program. And here are our presenters. So we're going to ask our presenters when I call your name and introduce you, if you would just wave at everybody. So we have Amy Dorsky from Chapin Hall in Illinois. We have John Korfmacher from Chapin Hall in Illinois. We've got Jennifer Welch-Buller from KU, that's Kansas University, and Aaron Mountain from Washington's DCYF, Department of Children, Youth, and Families, also from Washington's DCYF is Reagan Pierce and Shelby Yada. So thanks to all of our presenters for today. So let's get going. So first of all, let me just tell you guys who is here. So from our registrations, we're able to tell you that we have nearly 650 people registered for this webinar. You are from 48 states and the District of Columbia. From state agencies like Children, Youth and Families, Health and Human Services, Early Learning and Care, from city and county governments, from colleges and universities, CCR&Rs, children's museums, foundations, philanthropy, a wide range of places that everybody is from. We welcome everyone. And next, I think, is our word cloud. Love these word clouds. So when people put into their registration what your position is, this is what comes out of it. And as you can see, there's a wide variety of different kinds of positions that all of you hold. We've got CCDF policy consultants. We've got children's health program strategy specialists. We've got home visitors. We've got early literacy program analysts, assistant directors of CCAP. Very great. This is a really wonderful range of folks who are joining us today. Okay. All right, so here's how to participate. As I said in the beginning, I want everybody to just introduce yourself in the chat, which we see that people are doing. We want you to go ahead and put your questions for the panelists either in the chat or in the Q&A. And what we're going to do, I have some wonderful team support behind the scenes here, and they are going to make sure that we get your questions and both from the chat and from the Q&A. And then at the end, we would like for you to complete the survey. It's going to pop up. It's a very quick survey, but it's really important to us at BUILD to make sure that we understand how we did and what you thought about how we did, what you learned, what you might want to see or hear about in the future. It's a really important way for us to communicate with you guys and to plan our work and to evaluate our work. So those are the things that we ask for you to do. All right, I'm just looking in the chat. All these people are from everywhere. I'm so excited. Okay, everybody, thank you so much for coming. We're going to go to Illinois right now. So we're going to hear from John and Amy.
Hi, everyone. Thank you for joining us today. John and I are going to talk about the Illinois Early Learning Access Project, which we call ELAP for short. Next slide, please. So I just want to talk a little bit about our partners. So John and I are from Chapin Hall, but we couldn't do this work without our various partners. So Start Early, the Illinois Department of Children and Family Services, Brightpoint, and Eastside Aligned. Next slide. So the goal of our project is to increase participation in early care and education programs among children in traditional or kinship foster care and children whose families receive intact family services. And we do this in several different ways. We are enhancing coordination and communication among child welfare workers, early care and education providers, and caregivers. We're building infrastructure capacity. We'll be disseminating the information that we learned from this project. And we're also hoping to advance access across groups. Next slide. So the structure of our project is we have a leadership team, and we also have an advisory council. And Dr. Tate is a member of our advisory council. The leadership team is all of the organizations that were on that early slide. All of our partners are represented on the leadership team. And we also have work groups in 2 different areas of the state. We have one in Chicago, and we have one in East St. Louis, and those are the 2 areas that our work focuses on. Next slide. So our project has several different components to it. The first component was doing key informant interviews and a policy and practice scan. And those were really to get background information that would help drive the rest of the project. We've been doing a human-centered design process where we involved caregivers, early care and education providers, and child welfare caseworkers in both Chicago and East St. Louis. And we've completed both of those. The first two components of this work have already been completed. Now we're in the middle of the next stage of this work, which is testing solutions that emerge from our human-centered design process in Chicago and East St. Louis. And then the final stage would be to elicit feedback on the solutions that came out of Chicago and East St. Louis and other communities throughout Illinois. And now I'm going to turn it over to John, who's going to tell you a little bit about what we found so far.
Hello, thank you. So I'll present briefly some findings from the policy and practice scan that was conducted by our colleagues at Start Early. So just as a broad overview, Illinois has 3 state agencies that oversee ECE funding and program operations. So the State Board of Education, which is ISB, which oversees preschool for all and early childhood special ed. They also have the Prevention Initiative funding, which is Birth to 3 funding, which is around the state of Illinois, largely focused on home visiting services. There's the Department of Human Services, which deals with CCAP, the Child Care Assistance Program, and the Head Start Collaboration Office is embedded there. And there's also DCFS, the Department of Children and Family Services, which handles child care licensing. And of course, DCFS also oversees our child welfare system. One of the primary findings is that there is a fair amount on the books to address the issues of enrolling young children into early childhood and preschool services. So there are multiple rules and procedures that DCFS, for example, is mandated to follow that requires having a process in place for coordination between systems and getting these children into services. And this is all great. But these policies vary quite a bit by the type of child welfare involvement. So eligibility rules are different for children who are placed versus children who are in intact family services, for example. And they're often misaligned with the more general CCAP guidelines. The scan also revealed that data collection and reporting also appears to be lacking despite these rules and regulations. Data systems do not communicate very well with each other, and cross-system support is lacking. So, we sometimes talk about the early childhood service system, but when you do have these kinds of challenges in communication and you do have these silos, then maybe, you could argue maybe calling it a system might be a little bit optimistic. One notable development is that Illinois has created a new Department of Early Childhood that's going to bring most early childhood programs under one department by fiscal year 27. And so we do actually have great hope that this is going to be helpful in addressing some of this complexity. Next slide. So the other thing that, as Amy mentioned, is we did key informant interviews. So these were more kind of on the ground interviews with people who are either in the system or are using the system. And to compare it to what we had found with the policy and practice scan. And basically these interviews complement the findings of the policy and practice scan. The interviewees talked frequently about how enrolling children involved in the child welfare system into these programs can be difficult due to the complex eligibility criteria and funding mechanisms. There was a lack of knowledge of policies and procedures at the ground level among the EC providers and the child welfare caseworkers. As an example, some ECE providers are reluctant or unwilling to enroll children involved with the child welfare system without documentation such as birth certificates, immunization records, or guardianship papers. Even if there aren't actually any policies to say that these are actually required. And And informants noted that some families are reluctant to use early child care services because they fear that the provider might be treating them differently once they know that there's child welfare involved. So what we see at the system level in terms of collaboration, you also see at the provider level. So caseworkers often have limited knowledge of early childhood services or eligibility requirements and do not make enough use of resources that DCFS does have to facilitate this, such as regional school readiness teams within DCFS that exist precisely to support this kind of linkages, this process of getting children enrolled into these services. Next slide. So, as Amy mentioned, the other key piece that we have, kind of the centerpiece of our project, is a human-centered design process, which another group at Start Early has been overseeing. So the HCD process, which is unfolded over multiple meetings in the fall of 24 and then earlier this winter, it basically, we're seeing kind of a convergence. It further identified some of the issues that got raised, especially the complex eligibility and funding rules. They also noticed a fear or distrust of the system. And they also brought up transportation challenges as well. So these discussions, which were captained over time, eventually kind of converged or were boiled down into a smaller number of potential areas or identified solutions that can be that seem meaningful and can be tested initially at small scale and then can be disseminated out more widely. So by the end of the process, the human-centered design team facilitators helped the groups narrow down their focus to 2 solutions that both of them ultimately focusing on the first bullet point around eligibility and access. So one was helping increase awareness about the school readiness team that exists. So especially among caseworkers who, even though they are within the system, don't often know about this resource. So thinking about ways to kind of highlight their work and to foster those connections. And the second is to assist families to identify local ECE programs where they are eligible. And right now they are considering, and the human-centered design participants really were pushing the idea of creating an app-based tool that can be used to help with this. So now we're in the process where the rubber's hitting the road, and we're working closely with DCFS to actually determine how this is feasible, what this can look like, and how we can test it and see how it's going to go. So next slide. So our next steps are actually doing the piloting and testing of the proposed solutions in the 2 communities of Chicago and East St. Louis. We want to evaluate this process and look at the potential of these emerging strategies. So I hope you're not disappointed by Cynthia's pronouncement at the beginning that we will be telling you how to fix all these things, because we are still very, very early in the process of trying to get like a toehold on this. Part of this evaluation is we're trying to determine how state admin data can be used to measure future progress. So our pilot tests are meaningful, but they're relatively small steps, and so they might be important to the overall process, but it's unclear how well they will be initially reflected in larger state data sets. So our goal, though, is to be able to establish some baselines that is going to assist with future tracking, because hopefully, ultimately, we want to determine what can be scaled up to the state level. And so helping think about how this new Department of Early Childhood and DCFS can work together and can adopt these strategies across the state going forward. And that's our presentation. Here is our disclaimer and our emails if you want to get hold of us. But thank you.
Okay, John, I know I'm optimistic. I'm overselling. I know. I apologize, but not really. I just am staying optimistic. I think that you guys have learned some really great things. and then they're going to help people understand their own systems better. I also do agree with you when you said that maybe calling all of this a system might also be a little bit optimistic, but we do like to keep hope alive. All right. Well, thanks, John. Thanks, Amy. We appreciate it. We do have some questions, and we're going to get back to those. But right now, we're going to go hear from Jenny in Kansas on the KanLink program. Jenny?
All right, thanks, Cynthia. John, that was great to hear. I was nodding my head as you spoke. A lot of similarities still early on in our project, but really excited to talk to you about KanLink, which, as you hopefully can see on the screen, stands for Kansas Linking Infrastructure for Nurturing Kids. So as Cynthia mentioned, I'm Jenny Welch-Buller. I'm a research project manager from the University of Kansas Center for Public Partnerships and Research, a mouthful. So a lot of times people will just refer to us as KU CPPR. And our mission is to optimize the well-being of children, youth, and families through applied research, evaluation, and systems change initiatives. And we do this very closely with state and community partners. Couldn't do it without them. So this is a great example of some of that work, and really want to dive right in. So next slide, please. So our key project partners are listed on this slide, but there's many, many more not here, and I'll talk a little bit about them later as we move forward. But as I may have mentioned, KU CPPR, we serve as the evaluator, but we also provide day-to-day implementation support. There's a lot of day-to-day operations that go on to make this work happen. And the Kansas Children's Cabinet and Trust Fund, which is housed in the Department of Education at Kansas, is the grantee, as well as our state's preschool development grant, our PDG lead. The Kansas Department for Children and Families serves as our child welfare and prevention partner, and they also bring expertise and linkages to our broader safety net programs. So next slide. This slide talks a little bit about what we set out to do, our vision, our aim, and our focus. Our shared vision is that all Kansas families can connect to the services they need to thrive safely in their communities. And we know in Kansas from our data that children and families who participate in early childhood care and education services in Kansas are less likely to experience removal into foster care. And so our goal is to increase access to that early childhood ecosystem for all Kansas families and to reduce the need for child welfare intervention. So how we do this through policy analysis, ongoing iterative policy analysis across all of our agencies that are part of the early childhood ecosystem and programs therein. And we do this with families and agency leadership across the state, at the state level. And then at the local level, we also work on small practice-based pilots focused on creating or strengthening those linkages again to services. So a two-tiered approach at the state and local level. All right, next slide. So this slide shows a little bit about the structure that is really important to part of the KanLink approach. You'll see the arrows going everywhere, and that is just to convey that bidirectional communication to our steering committee, which guides our work. And these feedback loops are really an important part of what we've tried to build into our approach and our structure, so that everything that we do is driven by our individuals with lived expertise in the child welfare system and in early care and education system, and that it's aligned with our broader early childhood strategic plan in the state. So this going back and forth, communicating with these different groups you see here on the page is key. So our steering committee, which you see at the center, meets monthly, and the work that they do in those meetings is to review policies, lift up policies from their expertise. We look at child welfare data, reach data across the programs to services, and strategize in ways that we can improve it in many different ways. And then they also provide advice to our community innovation labs, which I'll speak to a little bit more detail here in a moment. We're fortunate to have a wide breadth of representation from across the early childhood care and education ecosystem on our steering committee. It's also made up of 6 lived experts and directors from state agencies and organizations to basically represent really various points of entry for families, which is key. We want to make sure that we're understanding where are families coming in, where in accessing services and resources. So some of those entry points that are represented on our steering committee are child care assistance, food assistance, our public health partners who administer WIC, and home visiting partners, child welfare, of course, and then our developmental and preventive screening programs, which are under our public health agency, as well as leadership representing our state-funded family resource centers. So we're very, very lucky to have just a wide variety of folks who are coming to our steering committees on a regular basis to help strategize. Ultimately, KanLink's work is guided by and accountable to our families with lived expertise, who early on also helped. We had a plan in place, but they helped adjust and co-create how we would operate together, and on a regular basis, evaluate that process, how it's going, and give us input. So I want to talk a little bit more about our lived experts on the next slide. So here in the next few slides, I really want to talk about what we're seeing is making this work, making this vision work. So our lived experts are really the heart and soul of KanLink. We have a cohort, they come together and meet regularly. And each lived expert receives a modest stipend for their time and their knowledge that they bring to the table. So they meet as a cohort quarterly to review policies, to look at our data, and we try to prepare some materials ahead of time to share with them. And basically also assess again, as I mentioned earlier, how are we progressing towards our goals, and they inform our priorities based on the feedback that they give and the input and perspectives. We're able to adjust on a quarterly basis, where are we focusing our policy analysis? Where are we focusing our conversations? And then we carry that forward into our monthly steering committee meetings. All right, we also recruited, I wanted to mention too that we recruited our lived experts from across the state. Kansas has some urban areas. We also have some rural areas, and we wanted to have perspectives from across the state. And they also bring different knowledge and lived expertise in early care and education, child welfare, foster care services. So that was important to us to have those perspectives contributing to our work. So they do provide on a regular basis, what we're finding is invaluable insights into gaps in the complexities of navigating the system, and point to places where sometimes well-meaning policies may be falling short in terms of practice and the day-to-day experiences of families. And these insights really challenge the steering committee to dig deeper into some policies and practices and craft really practical solutions that we hope will work for families. Again, we're in the early stages, and I'll share a little bit more about what we're finding here in just a bit. But one of the fun things I wanted to mention too was that early on our steering committee came up with meeting norms, and those when I talk about guiding our work, it even gets down to that level of guidance, which is how are we going to work together? How will we solve problems? What is our mindset? And so some of the meeting norms that our lived experts came up with really challenged the steering committee to stay committed to those moonshot aspirational ideas amidst what can feel like very slow work of policy change. So that's something we really have appreciated from this cohort. All right, next slide. I wanted to talk a little bit about our local innovation labs too. Lived experts also play a role at the local level in these innovation labs, which are also located across the state and led by 5 family resource centers in our state. So the goal of our innovation labs is to look further upstream for small, call them safe to fail ideas that would strengthen screening and referrals and coordination gaps in and between our early childhood care and education services. We also are trying to look for places where maybe it's unexpected or not our expected point of entry, doctor's offices, for instance, wherever libraries, where are families going where they might be able to connect and access services. So each FRC, each family resource center, then works closely with their family advisory councils or boards that they have at the local level to look for and identify opportunities to link more families to services, figure out what's working already, what can we build on, and ideally test new workflows that might be able to replicate a larger statewide level down the road. So a few examples of the pilot ideas include adding early childhood care and education screening into existing health insurance navigation services in one of our regions, partnering with local healthcare systems to create perinatal or prenatal care linkages. So partnering, with hospitals and health providers. Embedding screening and referral processes into a school district's enrollment forms and developing a process for following up and doing outreach through that partnership. And partnering with WIC programs via local health departments to increase screening and referrals for early childhood care and education services. So those are some of the ideas. Some of them are in very early stage yet, but we're learning a lot in terms of process and are very excited to see what comes of them. So in terms of support, I just wanted to mention too that KanLink staff provide planning and evaluation support, and the steering committee provides guidance. And so we're just at the stage now where we're starting to bring our family resource representatives, our pilot lab representatives into the steering committee for more regular updates and exchanges there. So that's very exciting. All right, next slide. So we're a little over a year into the implementation phase. We had a little bit of planning time up front where we were creating our meeting norms and the way we work together. And we're starting to see some progress and findings emerge in three main areas: processes, policy, and practice. In terms of process, we really are seeing that upfront investment, intentional sequence activities with lived experts is really invaluable. We're finding that it really ensures that family perspectives are centered throughout our work. We have to be intentional and again sequenced about that. And we also believe that it will show that authentic engagement at every step will lead to really stronger policy and process changes. And in terms of policy, our lived experts help the steering committee find gaps that I mentioned earlier between policy and practice and what families are experiencing at the ground level. And those insights we're finding are enabling the team to home in on practical findings, really practical things and recommendations. And that can look anything like just developing resource and referral guidance for staff. We are finding too, as you can see here, that sometimes what we're finding is really needed is just that assistance translating policy into day-to-day practice. So that's emerging in a couple of different areas. We're also learning that overall, while commitment to family engagement is clear across the board, Kansas largely lacks formal processes for connecting families to early childhood care and education policy at the state and organizational level. And so some of the things that are coming out from that observation are, one example would be we're developing an article that's co-authored with lived experts that outlines the best practices and engagement model with lived experts, and we'll share that with folks. We'll share that with you, Cynthia, once that's ready, and hope to develop a brief guide that comes from that. So that's exciting. And at the practice level, we're finding that small adjustments to workflows to increase those connections across the system are really easily adopted and sustainable, especially when strong relationships are already in place. We know that takes work up front. We feel really lucky that a lot of our communities have those strong relationships and that we're able to also benefit from our state partnerships and insights. But really, it's those adjustments to workflows that may not be written in a formal policy, but that can become formalized at the local level and hopefully sustained. So we're excited to learn more about those, and then of course share some of those as we test them out. Hi, Cynthia. I see that's my morning. Perfect. Almost there. Thank you. Some other examples at the practice level are we are collaborating with partners to create a child development training. We talk to our child welfare staff partners, and staff are finding that would be helpful for hotline staff to have some child development training, and adding processes for making referrals and links on to family resources on the investigation follow-up letter, check boxes on school enrollment forms, really finding a lot of small areas for big wins. But in conclusion, just a little over a year, we're really finding that lived expert leadership at all levels is key, really embedding that in, again, as I mentioned, as a practice. And while policy change takes time, some of the most sustainable and impactful solutions can be iterative and small scale. So we're really looking forward to creating more linkages and reporting back and on how families can connect to services they need to thrive. And also then hoping to share some scalable solutions that can make it possible in other communities. So thanks again for your time. Oh, I almost forgot, Cynthia, one more last slide. These are some key contacts I wanted to share. I know the slides will go out later, so these are folks who you can reach out to, or myself, of course, and I'll connect you to the right person with the right answer. All right, thanks again.
Wonderful. Thank you, Jenny. There's a number of questions for you for later, so stand by, they're coming, but thank you very much. We appreciate really also especially hearing about how you've incorporated the wisdom of learned experts in your work, and we're going to probably have some conversations about that as we move into the panel. And so now we're going to hear from the Washington team, Erin, Shelby, and Reagan, who will talk about the Child Welfare Early Learning Navigator Program in Washington State. Ladies.
Good afternoon. I feel an echo to the experiences that Kansas and Illinois have already shared. My name is Erin Mountain. I'm joined by two of my colleagues, Regan Pierce and Shelby Yeda. We work for the Department of Children, Youth, and Families in Washington State. Our titles are Child Welfare Early Learning Navigators, also called Navigators or SWELN, which is a pronunciation of the acronym. Next slide, please. This project started back in 2018 when Child Welfare, Early Learning, and Juvenile Rehabilitation formed to create the Department of Children, Youth, and Families, which is a cabinet level agency in Washington State. The challenge was to identify solutions to increase enrollment in early learning programs for families with child welfare involvement. Each year in Washington State, there are more than 23,000 families with children under the age of 5 that have varying levels of intervention from CPS, yet fewer than half of those families are accessing early learning services. We believe by utilizing community resources, we can prevent maltreatment, reduce entry into foster care, and improve well-being. In 2018, the department contracted with the Harvard Government Performance Lab to identify barriers and support strategies for engagement. They assigned us a fellow, Kate Lawyer, and she was absolutely incredible. Kate published a summary of our project, which will also be included as part of today's webinar handouts. Kate showed us how to use more of a business model to test strategies while we were using a social justice and equity lens. Kate helped us to use data to drive our work forward. And my core memory from this project was that Kate would remind us we didn't need to make a square peg fit into a round hole. This allowed us to pivot our work as the needs and tasks evolved. She reminded us that it was safe to try new things if our initial ideas didn't work. In 2019, our agency was awarded the Preschool Development Grant Funds, and this provided us more than 3 years to build the positions, test theories, implement ideas, and generate more buy-in with staff and community. Our funding for ongoing navigator positions were added to decision packages put before the legislature on several occasions, but were never funded. However, we were able to secure ongoing funding to support the current full-time positions, as well as expand to 13 full-time positions using CCDF funds or Child Care Development Funds. Next slide, please. So who are the navigators? It was important for our team that navigators had a background in child welfare. This was essential to ensure the navigators understood the pace and daily tasks of a child welfare caseworker, the flow of a case, and know the policies. We believe this helps caseworkers trust the navigators to reach out to their families. Equally, navigators understand the labyrinth of local agencies, the complicated eligibility requirements, and enrollment processes. The locations of our initial 3 navigators were intentional in selecting rural and urban offices and resource-rich and resource desert communities. This was to test strategies as we scaled the project statewide. As the program has grown, sites have been selected based on various reasons, such as location with higher critical incidents, as well as a team's readiness to participate. The IT and data folks supported this work by creating a report for navigators to include all children under the age of 5 on intake screened in. That helped to identify the families to contact so we can proactively reach out and offer resources rather than wait for a family to ask for help. Next slide, please. So we used the report I just mentioned to identify families that have children in their households under the age of 5. Once those were identified, we reviewed reports, case notes, and previous involvement to identify the potential needs of a family. Based on that, we contacted the caseworkers directly to share materials. But more often, we reach out directly to parents and caregivers to offer resources and support. And now caseworkers are starting to preemptively reach out to navigators for support too. When we contact parents, we ask them about their reported needs and identify programs within the communities that support those needs. And it's really important that parents know all our programs are voluntary and could be accessed without a navigator. We try to offer the warmest handoff possible, and having strong relationships with receiving programs helps to ensure families don't fall through the cracks. We will support the parents or the provider as much as we can with enrollment documents like immunization records and birth certificates. Programs or providers have a consistent point of contact with someone in the child welfare office if follow-up is needed. But best of all, parents feel comfortable contacting navigators if they have questions. I regularly have parents contact me from previous years asking for help reapplying for childcare subsidy or supporting enrolling a sibling into preschool. So next, Regan will talk about child welfare policies as they relate to early learning.
Okay, thank you, Erin. So looking at how a navigator can support the policy of Washington Child Protective Services, when a report comes to CPS, it's either assigned to the investigative pathway or the prevention-focused alternative family assessment response. Both of these caseworkers are required to make a referral to early support for infants and toddlers for a child under 3 who is identified as potentially having a developmental delay. With all the other requirements and responsibilities of those frontline workers, this step can be easily missed. Child welfare workers receive specific training on assessing for safety and immediate dangers, but may lack knowledge of early development or fall into that trap of just reporting the child's nonverbal, they weren't interviewed, they might just do a brief visual observation without diving deeper into the child's needs, particularly if that child is not listed as a victim on the report. Family assessment response caseworkers are also required to refer non-school age children to preschool, licensed childcare, or home visiting services. They're supposed to act as a resource broker for families who are brought to agency attention for those lower level concerns. But the early learning navigators strive to refer families to community support that can continue to help children and parents feel connected and cared for outside of the child welfare system. When looking at cases where the child is already in care or child family service cases, there is a worker assigned to complete that initial assessment when the child comes into care. That's called the CHET worker, the Child Health Education Tracker worker. And so that worker makes recommendations for follow-up, and the assigned ongoing caseworker is responsible for ensuring that the children have access to those services. But as cases change workers or children move placements, those services may not continue. So there may also be new concerns that come up for the child after that initial screening, and that's another place where a navigator can provide support. We consider that when children are engaged in early learning and childcare programming, they're protective supports, and we encourage families to continue with attendance when children are able to safely return home to their family of origin. Next slide, please. Thinking about how we support over the life of a case and focus on prevention, early learning navigators can provide guidance and support for caseworkers and families from that initial intake all the way through to a permanent plan like returning to parents, adoption, guardianship. Starting with that first contact with the department, the focus is on prevention. What can we do? What resources would best help the family to mitigate the risks that brought them to our attention? Navigators highlight the voluntary basis of early learning, like Erin mentioned, while discussing their benefits and normalizing the struggle of raising little ones. We have respect for what parents feel is the best fit for their child and acknowledge they are the ones who know their child's needs the best. So thinking about all the ways that early education support, having that dedicated social worker who is knowledgeable about both early education and child safety CPS processes, this allows for specific individualized referrals and resources that go beyond the day-to-day casework of line workers. It can also support active efforts, which is a higher level of support and care required for families that are enrolled in federally recognized tribes or that have reason to know they may be eligible for enrollment. This support is available after case closure to allow for continued engagement without prolonging the time the case is open. The goal is to connect the family to services which can create those protective relationships that can reduce repeat referrals and give the parents confidence to seek help from the community if an issue arises in the future. Our next slide is going to be looking at the individualized way that navigators have tailored their practice to fit their community. So we've each kind of taken on a different approach to what makes sense for our office and what makes sense for the area that we live. This slide shows a color-coded map of each of the 6 regions Washington Department of Children, Youth, and Families is broken into. The early learning navigators are also positioned in different areas within DCYF organizational chart, which allows for diversity and varied levels of input across the structure of the agency. The dark teal color on the map indicates tribal land. Carla, who's our specific tribal swellin or navigator, is organizationally situated in the Office of Tribal Relations. She works closely with the tribes in our state to learn about their already established early learning resources and to discuss how families can qualify for those services. Region 1 is home to Shelby, who's here with us today, and she's situated in the programs world of DCYF. That's a social worker support position, and it aims at referring to early learning supports off the plate of the Child Protective Services social worker. Shelby is often going out in the community to assist parents one-on-one with completing childcare forms. She's touring centers with them and providing a personalized hands-on approach to supporting parents. Region 2 is lucky to have 2 navigators, including one of the originals who has been in the position since 2019. I'm the second navigator in Region 2 here on the eastern side of Washington. Cindy and I are also part of the regional programs team like Shelby in Region 1. And while all the navigator positions are grant funded, there was a time that Region 2 wanted another navigator so badly they included the position in their budget for the region. I have taken on supporting caregivers with children in out-of-home care in addition to offering guidance and information for Child Protective Services and voluntary service workers. Regions 3 and 5 are home to our newest navigators, Amber, who sits in child welfare field operations and is supporting several counties in Region 3, which is that mint green color at the top of the map. She's working closely with a new program out of Whatcom County that is a single entry access system to streamline referrals to multiple agencies through the use of one application. Jenny in Region 5 is growing her list of early learning partners and has strong ties to the community, which has allowed her to create relationships with social workers and providers. Our tribal navigator, Carla, is also in Region 5, but she works across the state. So Jenny, Region 5, Megan and Karina, who are both in Region 4, sit in Partnership Prevention and Services Unit, which is a headquarters level unit that focuses on supporting families through service management and preventing further involvement with child welfare. Megan and Karina have taken their own spin on things, and they took over a community-driven practice where they would anonymously staff child welfare cases with a large group of supportive agencies in the community. The agencies listen to the assigned workers, staff the scenario with the names and identifying information not included, and then services and suggestions for supports are offered on the spot. That could include real-time referrals to ESIT, which is satisfying what I talked about earlier, that 2 business day policy, or agencies can live report openings to Head Start and home visiting programs that can increase the likelihood of engagement. These occur several times a month, and they allow the navigators to touch many cases across the Seattle area and surrounding cities. Finally, Region 6 has 2 swellins, Aaron, who's here, and Allison. They work together to cover a large portion of Region 6, that is that light purple color on the West Coast. These ladies are also on the regional programs team and focus on prevention and support for the frontline cases. Erin is part of multiple early learning coalitions to keep a pulse on what is happening in birth to 5 circles. Like many of the navigators, Allison moved to this position after several years as a child protective services worker. So she has intimate knowledge of the CPS process in the office that she serves and a close relationship with other frontline workers. Allison and Erin have created a newsletter to share with caseworkers in their region to bring attention to the support they offer and provide education about early learning topics. I'm going to pass things over to Shelby as she shares the success of our program.
Thank you, Regan. As you just learned, each region in Washington State has created success in their own way and collectively as a group. We're able to work together across the state to create success by building relationships with caseworkers and utilizing our already established relationships in DCYF, which fuels the trust during collaboration. We have the time to connect with community partners and be involved in our early learning coalitions in each area, which allows us to be up to date on community services as they evolve. We each pull expertise in early learning and case management, which makes a larger impact during our engagement with clients as a neutral party. We are each able to provide trainings to our community partners and to department staff. We are also utilized during case consultations to ensure all community resources were sought. We can provide feedback and give suggestions, and we also engage in fatality or near fatality statewide reviews with an early learning lens to help change future policy or practice. Next slide, please. Since the beginning of Swellen work, the team has expanded throughout Washington State. The purple bar on the graph above indicates the number of children navigators have assessed for that year. And then the red line represents the percentage of eligible population in the state that we were able to assess. Keep in mind that includes regions that do not have a navigator. Now in 2024, our current navigator team of 10 has been able to impact even more families, connecting with 25% of eligible children, which is a quarter of the population in Washington State that are involved with DCYF. It was shown that areas in the state where navigators are present, there's 44% more children involved in early learning services than in areas without a navigator. Together, we have assessed, connected, and completed referrals for well over 5,000 families involved in child welfare this year alone, and that is 1,000 more children served from 2023. Each one of us has built a unique relationship with our providers, and we're able to complete direct referrals to services such as ECAP, Head Start, developmental assessments, and home visiting programs. We also have access to a child welfare continuing child care referral through our Washington State's Working Connections Child Care Subsidy Program. So this allows any family within Washington State that is involved with child welfare to access 12 months of free childcare at any licensed childcare center without restrictions. And that means the family does not have to be employed and there's no income restrictions. This data is going to continue to rise as our new roles become established throughout the state and as DCYF works together across systems to simplify engagement and services. Next slide, please. Our work is very unique, and we actually have to collect our own data and work with the Office of Innovation, Alignment, and Accountability to analyze our work to show the impact we're making in our communities to continue to build our Navigator program. The goal is for each region to have at least 2 navigators with the ability to support all offices across the state, which we do not have the capacity to do at this time. An ongoing barrier to our work is the lack of access to other systems. If we were able to access more systems, it would only help streamline enrollment to programs for our families and reduce any of those barriers that they may face. Something as simple as accessing immunization records. The navigators need to continue to build positive relationships within the department and in our community to show the value and importance of the navigator role and how we can promote long-term positive outcomes for children by decreasing child abuse and neglect intakes through early learning and family support connections in our community. Thank you so much.
Wonderful, wonderful. Thank you. Right now, I have like 15 questions simultaneously for all of you. Really good, great information. You guys have so much activity going on in the chat, in the Q&A. People have a lot of things that they want to talk to you about. Can we bring everybody on the screen all together, and then we can have this, have a wonderful panel discussion? Because the first question that I want to really ask everybody is, okay, great, we're getting there. What did you hear? Well, first of all, I want to make a comment of what I see going on in the chat, that I think is just so wonderful. We have all these people from Illinois and Kansas and Washington that are in the chat, that are talking. They're like responding for you to some questions that you might be getting. I don't know if you guys probably couldn't see this. They are here to support you. They're saying things like, go, go, yay, Regan. That's somebody's, there's really, there's a real sense of community and a real wonderful level of support going on in the chat. That's not just questions. It's they're here for you. So I just want to make sure all of you presenters knew that. And I also want to thank all those who are in that chat supporting your colleagues. This is the way we create community, right? Everybody really did really well, by the way, in terms of your timekeeping. So I only had to put up my fingers once. So nobody ran over, which means we have a lot of time for this panel discussion. So the first question that we've got some really concrete ones, but the first one I really want to ask all of you is, as you listened to the other presentations, wondering if you heard things that really resonated with you. If there were things, yes, Aaron, you're nodding your head. If there were things that you heard that you were like, yeah, we found that out too, or things that you heard that say, wow, I think that we should try that, or it resonated with you in whatever way from your colleagues here. Aaron, can I start with you? Because you're really nodding, and I remember you starting with this kind of an idea, right?
Yeah, a lot of the things that Kansas and Illinois are finding, I think we really we found those same barriers and also implemented similar strategies. And so I think a lot of the policy restraints and also just trying to connect across systems has been a challenge for us as well.
Yeah. For sure. Because this is something that is, the challenges in collaborating between these two systems, those challenges weren't created state by state, right? And so you're going to find when you listen to other states having the same kinds of challenges, right? Anybody else heard that? I know there were people also commenting that there were some components of your work, solution type components that you had in common from state to state. For example, the Child Welfare Navigator, the Child Welfare Early Learning Navigator program in Washington, and the Erickson DCFS program, as well as the program that's run within DCFS in Illinois, to help these kids get into the right programs. I wonder if Illinois or Washington, if you wanted to comment about those particular programs and how they, well, this is your whole program, but talk in particular about how you see that other people in other states may be able to create or pick up what you are doing. Let's start with Washington.
Well, one thing that I think is really helpful is just the personal relationship part, that there's providers and contacts for different agencies in the community that they know my name, they can call me, I will respond to them. It's not sending off a referral into no man's land that you're not sure where it goes. They can pick up the phone and say, Regan, can you help me with this referral? And I do think that that is very helpful. Or, I believe this child might have had child welfare involvement before. I can't get a hold of them. I want to know what, I want to follow up, and I want to make sure that they're still engaged in services. So I think just being a real human person to be able to have a contact and be someone that answers the phone and can reach out and let them know, hey, let me follow up on that. And I strive to always respond to people when they call me, even if I say, oh, I can't give you that information, or I'm not sure, I'm not able to help you. But that is definitely a big part of the culture that navigators have in Washington that we've created for ourselves. And I think that has led to success for us as well.
Yes, relationships are everything, right? And we do have a question for you guys also, in particular about whether or not within the context of those relationships with parents, if you're able to do things to support parents' understanding of children's developmental needs, or are you able to contact or engage with mental health consultants? Or I see you nodding. You guys are able to do those kind of things?
Yes, absolutely.
Yeah, sorry.
Okay.
I was gonna start. I started typing in the chat a response, but we
Okay.
so as far as like educating on development, the our agency contracts with evidence-based programs like Incredible Years and Project Safe Care for families who are involved in deeper into our system. And then we are working on ways to educate our staff on child development, as that is kind of an area we find that, caseworkers are either young and don't have experience with small children, or they just don't recognize when there are like some concerns. And so I know, I think maybe Regan can respond to more of how they're training staff.
Yeah, our region has a specific training that is rolling out to discuss milestones for caseworkers, and we have DCYF as a whole has a handout that is a quick guide for different milestones for different ages. And just because you don't have kids, there's way more reasons to not necessarily know. You might see a child and assume their age, or children may be smaller, and so you're not sure. Or sometimes, people's perceptions, or there's like cultural differences in how people do things. And so thinking about when there is a true concern, if a child is 2.5 years old and does not say one word at all, or sometimes people will say, oh, well, they're 3 and they're not potty trained yet. That doesn't mean a developmental delay, but just sort of some education around those pieces has been important, and trying to create tangible things that workers can take out in the field with them. Or we ask those questions over the phone. They'll say, oh, the child's meeting all developmental milestones, but what does that actually mean? Is your 18-month-old pulling themselves to stand, just now? That's more of a 9-month-old milestone. So thinking of some of those things and helping to just reinforce what's already out there.
And that's got to be so helpful, because parents, whether you're a foster parent or a bio parent, you still have questions about the developmental progress of the children in your care. I wanted to just go to Illinois for a second and ask about both about how child development knowledge is supported by both the partnership with Erickson and the School Readiness team that's there in DCFS, and how those two components actually work to try to overcome some of the barriers that you guys are finding that exist between the two systems, and support parents in the meantime.
Yeah, so I can talk first. I'll address the Erickson piece. So I actually work closely with the folks at the Erickson Institute as part of our effort to enroll children and families that are receiving intact family services in home visiting programs. So this is an effort that's part of the Illinois Family
Mhm.
First state plan to enroll more of these families with young children in evidence-based home visiting programs. And Erickson plays a really key role in that. They have home visiting specialists whose job is to help connect these families with programs in their community. So and Chapin Hall is involved in a CQI process to make sure that's working. And then with the school readiness team, their focus is more on slightly older children. These are like the preschool age children, and the idea is to connect them with Head Start and early and pre-K programs throughout the state. I'd say one of the challenges that we've kind of run into with our project is that the focus of the school readiness team is really on children who are in foster care, and less on children whose families are getting intact family services. And so one of the things that we would like to see come out of this project is more attention being paid to those children who are not in care, but whose families are involved with the child welfare system. And I'll let John elaborate.
John?
Well, I think I was going to say, I thought Amy said it really well. I do think that there's kind of there's dual concerns, and one is that there are not enough people who actually know about the school readiness team as an actual resource, particularly caseworkers, for different reasons, maybe because of like the turnover of caseworkers, because caseworkers in Illinois are often, they're not hired within the DCFS system. They're independently contracted. They're at agencies who have contracts. So there's lots of things that the caseworkers aren't always able to keep on top of. And so having this as a resource is potentially really valuable, but they don't know as much about it. But at the same time, if we talk about like, the school readiness teams are all based in regions of Illinois, and there's also they also don't want them to be kind of like suddenly flooded with requests for help from intact families, where they traditionally haven't really worked with them before. So there is this kind of this like, I don't know, kind of we're kind of like having, when we're talking with DCFS, it's kind of like threading the needle that way about both kind of increasing awareness, but also recognizing that there are, given the size of the programming that of their, of these units, there's only so much they actually can do.
Yes, absolutely, for sure. I just want to also, just for everybody on the line whose state may not use the language intact families, just let folks know that what we mean. Well, let me ask you to let people know what intact families means.
So these are families who have not been, where the child has not been removed from care, and they're not placed in a foster family, or they're not being placed in like a relative foster care system. So they're still remaining at home, but they're still being monitored, and they still have a caseworker assigned to them.
Thank you.
And typically their time in the system is shorter term.
Yes. Thank you. So that's what makes the work focused on the intact family cases also preventive work.
Yes,
right?
absolutely.
Yeah.
And
so
eligibility requirements for child welfare services is different for children in intact family services than in children who are under care of DCFS. And so that's one of the things that's very confusing to families, is how different the eligibility rules are for Head Start and for the early childhood programs.
Oh, interesting. Yes. Well, I wanted to just do a shameless plug for our webinar that we did last month on home visiting. And as Amy was talking about, the Illinois Home Visiting Partnership with Erickson was featured there. So if anybody is interested, those are in our resources that you can get online. Okay, also, now, Jenny, I'd like to really bring you in this conversation right now. And one of the ways that I want to bring you in is I want to talk to you. I'm thinking about your slide that has all these components, all these different partners. and folks that are working together in various ways. Can you talk about the importance of partnership in this work? I mean, we talk about
Absolutely.
cross-system collaboration like it's two
Yes.
systems and that's all, but really it's a lot of partners. Can you talk about that?
Yes, a lot of partners, which is so crucial to part of what we're trying to do with KanLink too, which is go for start a little bit further upstream before families are engaged in the child welfare system. To what extent can we, by referring to early care and education, reduce those numbers? And we're looking at the whole course pathway, but that's something where all of those partners are essential. And I think there's a chat earlier that this might connect to about developed approaches to institutionalized relationships so that when there's turnover, when there's change, those connections still exist. And I think I have to give a shout out to some of the last several years of under the preschool development grant, really helping create intentional infrastructure or efforts to bring people together and create the broader governance structure. And so part of that, what that looks like is the Children's Cabinet in Kansas is the lead agency that helps bring together our partners across the agency. We have a directors group. And then we also have an early childhood recommendations panel that has representation from across the ecosystem, as well as family representatives and folks who are on other required local RSIC or other statewide or local agencies. So that has really helped. You know, I think that taking that time to intentionally craft those relationships and that infrastructure creates then opportunities for us to build on that with KanLink, for instance, and dig deeper into the topics we're trying to build into. So what that looks like in day to day, as I'm sure you all probably have had experience, is it takes time. It is folks coming together and making agendas, having a shared vision, and our strategic plan as a state, our early childhood strategic plan and needs assessments have been really helpful. And bringing together shared data is right as well, and trying to use that to strategize across the agencies. So I hope that helps a little bit.
Yes, that's great. That's good. Let me take this partnership question to Illinois next, because Illinois, you've got some really significant partners in the work that you've been doing. You want to talk about partnership there? You're on mute, Amy.
Okay, how about that? Okay,
That's better. That's better.
I'll start. So yes, we have 4 partners. As I mentioned, we have Start Early, which is brings their expertise in advocacy and policy around early childhood. DCFS, our child welfare agency, and then 2 nonprofit organizations, Brightpoint, which is actually a provider of both child welfare and early childhood services, and Eastside Aligned, which is in East St. Louis, and they do a lot of partnering with other organizations. So having them all at the table, everyone brings different areas of expertise, and it's been a really great collaboration so far. I don't know, John, you want to say what I don't know what you want to say, but feel free.
No, I mean, the thing I would Start Early actually is it's 2 different parts of Start Early, which has been really helpful.
Oh, that's right. Yeah.
Policy. So we have basically some policy experts. They're the ones who help write the policy and practice scan, but then the human-centered design group is a different unit of Start Early. And so that's really their kind of specialized focus. So it's been nice to actually have both of those people, those groups together at the table. In terms of our community partners, Brightpoint is a large statewide organization that has a bunch of different, it has services around the state. And so they have both, even though they're representing kind of the Chicago programming, they also have a broader view. And Eastside Aligned is very much just kind of on the ground, almost like kind of classic kind of community organizer. And so it's been very helpful to have all of these different perspectives together as we try to figure this thing out.
Yes, good. As you talk about, Illinois had you guys did your research in the 2 communities that were, very different and disparate. And And then, it's making me think also of Washington and the case that you made that was so clear about, the different regions within Washington and the particular ways in which those regions have learned to respond to the needs that are in those regions. And then I'm thinking, Jenny, of what you were talking about in the involvement of your lived experts, which was a different version of the same of the human-centered design process that Illinois went through. But in all three cases, you all got really input directly from the folks in the communities that you are based in and are serving. So what I would like to ask you based on that knowledge, what do you think, what do they say? What do the folks that are in those communities, whether it's through your human-centered design process or through your lived experience folks, Jenny, on your steering committee, what are they saying specifically, concretely? And I want to say that you think is probably most important to hear in terms of what the barriers are, what makes it hard to do this? What makes it hard? Anybody can start. It was for all three states. If you had to pick one. I think you talked about gaps in policy and intent.
Yeah,
Jenny?
yeah, I can
Yeah.
speak a little bit about that.
Yeah.
I'd be happy to. So having these conversations about policy with having our lived experts bring their perspectives on what really just feels like a complex system, right? There's just so much on their plate at the time, and we hear already today have gone through many acronyms and programs, and really what is it that I need and want in the moment? Where do I go first? Where are my trusted sources of information? So some hearing their perspectives on the intent and the commitment. So for instance, our lived experts have shared when it comes to family engagement and leadership across different levels. The organization said we're sensing the commitment to that, but we're not seeing it necessarily in the day-to-day. Or, oh, observations like I didn't know that I was automatically eligible for Head Start. I know also there's a lot of empathy for staff who are providing services. Well, observing, for instance, that they're just very busy. I feel bad for them. There's just quite a diverse perspectives or different perspectives that folks are bringing to the table that allow us to home in on like what are some of those small changes we can make it in the short term that would ease the process for staff and for those who are receiving services. So really it's just kind of the trusting that when I go somewhere, they'll be able to give me some basic ideas of resources, and that ideally what we're also running to is that there will be resources at the other end of that and capacity to provide the services. So there's another layer that we're finding can be challenging as well.
Mm-hmm. Thank you, Jenny. I'm thinking now also about this issue of distrust of the child welfare system and the challenge that always brings when we talk about collaboration between the two. And I am of the opinion that the best medicine for distrust is relationship building. Does anybody want to talk about how important these relationships are? You in Washington, you guys, as early learning navigators, you build direct relationships with everybody, with the parents, with the caseworkers, with the providers. How do you do that? How do you find people who know both systems? How do you go about addressing the distrust that exists there? And any one of you can speak to that.
I feel like leaning on engagement skills. I came from Child Protective Services, and you have to go to somebody's house and knock on their door or call them on the phone and have this very uncomfortable conversation about something that is most precious to them in the world, about their children, and have this really difficult chat with them. And that requires skill and finesse and engagement to be able to then come around and say, but I want to partner with you. Let's figure this out. You know, what do you need? And providing that skill. And that's really where social work, you know, is important. So you have to, part of building that trust is if I tell you I'm going to send you childcare options that have availability, that I send that message, that I follow up with you again and say, hey, were you able to fill out that paperwork? Shelby drives paperwork to people's house all the time, sits down and helps them fill it out with them, and then turns it in to the center. She is reducing all those little gaps in getting that done. And she can talk more about that too. But I really feel like the engagement part is what's important, and just truly caring about this role. And I want kids to be in programs.
Yes. It comes across, you can feel it when you talk. Shelby?
Yes, and yeah, I would just like to add too, and our role is so unique where we're not the ones coming knocking on your door. You know, clients specifically will want to clarify, well, are you an investigator? Like, what is your role? And so I get to explain to them, you know, that I'm just here to strictly connect you with community resources and nothing that the department has to offer. And that really, I think, opens the bridge to make those connections and help them in a way that maybe a CPS investigator cannot. And really just have those one-on-one conversations with the parents. I think it does help. And so building those relationships also with the providers and being able to connect the families to those services that kind of disappear or fall through the cracks, if you will, because we're able to come back through and connect with families even after a case closes, and making sure that they reconnect with that provider, and just making sure that we're their support. And like Erin mentioned in our presentation, is I've only been doing this role for almost a year now, and I have clients that cases have closed 5 months ago, and they reach out to me and they're like, hey, can you help me now? And I'm like, yes, of course I can. Being responsive, like that is the number one thing. You know how many people say nobody calls me back? Well, we're here, we're local, we show up and we call you back.
Means a lot.
It does.
Means a lot. Yes. Erin?
Well, I was going to just piggyback on what Shelby said. We just have more flexibility in our schedule. Our pace isn't hair on fire all the time, like many caseworkers do. They just don't have the capacity to call people back. That includes community providers too. And I think sometimes when a community provider got a referral from an assigned caseworker and that case was closed like 6 months ago, they've met 300 people since then. And so they likely won't call back a provider, where we have that capacity to just like dig in and find out where that kid went and why they stopped showing up, and try to re-engage them either that same program or like wherever their new community might be.
Yes, that's so important. You know, what also comes through when you're all talking is a real understanding, compassion of every person involved in what it is that you're doing, that you're linking together: the parent, the caseworker, the provider, you know, all the pieces. Because often what we hear is, you know, there's a lot of misunderstanding or a lot of lack of real compassion for what any one person in this whole picture is really dealing with. And so I just want to say that your understanding, your compassion comes through very clearly, so we can see why your programs are so successful. I have a few more questions, but I have not a few more minutes. So I'm going to ask you, this has been a really good conversation. I want to thank all of you again. I want to go around and ask you for your one final thought in 1 minute or less. But if you have one final thing that you wanted to express to all of our folks that are on the line here, what would that be? And anybody can start. And if nobody starts, I'm going to call somebody.
My final thought is an Audrey Hepburn quote, and it's: the best thing to hold on to in life is each other. just again, reinforcing that the collaborative professional relationships between workers within the department. We want to collaborate with chat workers. We want to collaborate with community partners, anybody that we can work together with. The goal is supporting families.
Beautiful. Thank you, Regan. Who's next?
I'll go next. My final thought is to all of the agencies and staff on this webinar to be brave, keep going, test new ideas, and don't give up.
Don't give up. Thank you.
Okay, I will go. Our work is truly shaping our next generation, and we're doing it while decreasing risk of generational trauma and abuse. And this role, it's the best of both worlds to fill that. So it's wonderful.
Wonderful, wonderful, great. Thank you, Shelby. Next.
I can go next. I just want to share that what we've learned and believe in is that authentic and engagement of lived experts, folks who experience the policies at the ground level in real time, is invaluable and essential to really building and developing policies that are meaningful, so and effective, and it just is a joy to dig deep together with those who are experiencing the system across our early childhood system and collaborate together. So it's a real honor.
I'll say that the people who participated in our working groups really appreciated the opportunity to express their feelings and their ideas and contribute to improving the system.
Yes, people feel good when they're listened to. Thanks, Amy. John,
Yeah,
you're the last one.
I mean, I would add, I would just reiterate that I think this has been a really nice experience of looking at participatory action, participatory action research in action, but just being able to listen to them. And I think the other thing that I've taken away from this is that it's, everybody is working as hard as they possibly can. And everybody's doing as good a job as they possibly can in the moment. And it doesn't mean that there aren't ways that things could be like dramatically improved, but everybody is, everybody's working really hard, and sometimes the system gets in the way of getting things accomplished, but other times it's a matter, I think, of communication.
Absolutely. There's some more of that understanding and compassion that I was just noticing. All right, well, we are out of time. I just want to ask all of our participants to fill out the survey that's going to pop up. And again, I want to thank each and every one of our panelists who have brought something unique and special, informative, and personal to this conversation. I appreciate all of you. Thank you so much. And goodbye to everybody. Bye.